CTEPH is a rare and serious form of high blood pressure that impacts the lungs and heart. Here at University Health Network, our groundbreaking program is helping people with the disease live longer, better lives.
Today we'll walk you through chronic thromboembolic pulmonary hypertension, what it is, how it's diagnosed, and how we treat it here at Canada's only CTEPH treatment program. CTEPH affects the arteries in your lungs and the right side of your heart. The condition starts after a pulmonary embolism when a blood clot travels through the heart and moves into the lungs, causing a blockage in the arteries. In some people, these clots do not dissolve naturally and can turn into scar tissue that narrows or blocks blood flow.
That's a problem because these arteries carry oxygen-rich blood to your lungs and heart.
When these vessels narrow, the pressure inside them rises. That forces the heart to work harder to push blood through, weakening it over time and making it increasingly difficult to breathe and can lead to heart failure. CTEPH is life-threatening if left untreated. Without proper treatment, fewer than half of patients survive beyond 5 years. With surgery, up to 90% of UHN patients see dramatic improvements in their breathing, energy levels, and overall quality of life.
At UHN, we've performed over 700 CTEPH surgeries since 2005.
We're proud to be the only hospital in Canada with a dedicated CTEPH surgical program and the second largest treatment center in North America. CTEPH symptoms often emerge slowly and can be mistaken for other conditions such as asthma or COPD. Someone with CTEPH may experience shortness of breath, especially during physical activity, chest pain or tightness, swelling in the legs, lightheadedness or fainting in some cases, a bluish tint to the lips or fingers. Because the signs can be subtle and develop over months, many people aren't diagnosed with CTEPH right away.
Diagnosing CTEPH begins with awareness, both from patients and their physicians.
When someone has had a pulmonary embolism and remains short of breath, doctors should consider CTEPH and request specialized testing. Echocardiograms to examine heart function, CT pulmonary angiograms to look for scar tissue, ventilation perfusion scans, and right heart catheterization to confirm the presence of pulmonary hypertension. Early detection and diagnosis is critical to patient recovery. If left untreated, CTEPH can lead to irreversible heart damage and heart failure. Once the heart starts to fail, recovery becomes much harder and surgery becomes riskier. In all cases, the damage can be fatal. That's why early referral to a specialized program like ours at UHN can be life-saving. The most effective treatment for CTEPH is a surgery called pulmonary thromboendarterectomy, or PTE, to remove the scar tissue that is blocking blood flow to the lungs.
At UHN, we've refined our surgical technique to treat complex cases once considered inoperable. Up to 90% of patients experience significant symptom improvement after surgery. For disease located too deep in the lungs or when surgery isn't an option, other treatments are available.
One is medication to support heart function. Another is balloon pulmonary angioplasty, or BPA, a minimally invasive procedure that uses a small balloon to gently break down scar tissue and open block vessels, improving blood flow. These treatments can also be used alongside surgery to support recovery.
UHN is leading the future of CTEPH care through research, innovation, and training.
We are developing more accurate imaging tools, advancing surgical methods to improve safety and recovery, building global partnerships to share knowledge and raise awareness, and training the next generation of CTEPH specialists to increase surgical capacity across Canada.
Here at UHN, we are pushing the field forward to ensure more people can access the care they need. If you've had a pulmonary embolism and are short of breath, speak to your doctor.
Ask if your symptoms could be linked to CTEPH and request a referral to a specialist for testing. An early diagnosis could save your life.